Hello, and welcome to the launch of the Behavioral Health News Spotlight on Excellence series, featuring exceptional leaders and innovative healthcare solutions that are raising the standard of care in the behavioral health community. Today, we are speaking with Steve Miccio, who is the Chief Executive Officer of People USA, located in Poughkeepsie, New York. Inspired and driven by his personal lived experience, Steve has spent over 2 decades creating, providing, and promoting innovative crisis response services and system-level improvements both across the United States and internationally. These improvements raise the bar on customer service, person-centered communication, trauma-informed care, empathy, and positive expectations for people's recovery and wellness outcomes. Steve's unique models and approaches significantly reduce hospital utilization, incarceration rates, and overall healthcare spending. Steve, thanks so much for being here with us today.
Thank you. Happy to be here.
Why don't we begin by talking a bit about the Crisis Stabilization Center in Dutchess County, New York. So when did it open and who does it serve?
So it opened February 13th of 2017, and it serves the community of Dutchess County, which is about 300,000 residents. It also serves other counties because people hear about it and come from other counties, but it serves everybody, I think is the best way to put it.
Mm-hmm. So what was your inspiration for developing the center and how it got started? What was your goal and also how was it funded?
So back when they were closing, I had been doing a lot of work in building peer respites. We're a peer-run organization, and 21 years ago, I started the first respite, which is a 7-day stay for people dealing with crisis issues. But when they were closing the Hudson River Psychiatric Center here in Dutchess County, there was reinvestment money that was going to be given to the county, and the county executive put together a committee of behavioral health leaders in the county to figure out what to do with that money. And we got together as a group, and one of the first things we talked about was the need for a mobile team, some kind of mobile crisis team, because there was a lot of that need out there and it wasn't being addressed. And that was something we all agreed on. There were some other small dollars going to my having a peer in the emergency room here in Dutchess County. There was some children's service dollars that went out there. But I remember in the meetings that we were having with the county exec, they kept talking about integration and collaborations. And what always struck me is that we always, as providers, have come to provider meetings and said we all work together well, and we do provide good collaboration. But I wasn't seeing that, So I was really kind of holding to my truth, which was we need to develop a better system of care for people because we're not providing it, and I think we can do better. And so one of the things I brought up was a wellness center. I didn't call it a crisis stabilization center. I called it a wellness center. And I've been traveling around the country in different parts of the world, looking at crisis services and what they were designing and doing. And a couple of them just struck me that they were very fast and efficiently greeting the guest and finding out what their needs are and moving them along in a continuum. And that's what I wanted to create here in Dutchess County. So I kept talking about it at the meetings, and the county executive finally said, well, let's give it a shot. And he went to the county legislation and asked for the money to not only open the program, but also renovate the building that we were working in. And so we redesigned the building. We put together a workflow and a plan of how it was going to run. And we put it together in about 1.5 years and opened.
Wonderful. So now that it's been established for a little while, can you elaborate on the services that are provided? Are they provided all in-house, or is there partnerships with community provider organizations that play a role?
Yeah, this is really about partnerships and community collaborations and follow through. And so anybody can come to the center, be experiencing a crisis. It's voluntary. There is no mandated treatment at the center. And they can be experiencing mental health issues, emotional issues, addiction issues, substance use issues, even health issues when they come to the center. And the center is designed to do an assessment to figure out what's happened to you, what you need, and get you to that service in the community within 24 hours. We actually have 23 hours and 59 minutes, but within 24 hours. So we can get someone into a medically supervised detox, a regular detox, rehab, medical care, or mental health care within those 24 hours. And that's a lot of working with the community providers and partners to ensure that we're going to be able to move someone in that continuum that fast. And that's what we do.
That's wonderful. What is the philosophy of how you operate?
The philosophy is really around wellness, around a strength-based focus on excellent customer care. I want it to be as good as a 5-star hotel that somebody would walk into when people walk in, to know that they're welcome, that they're greeted with a smile, that they're greeted with kindness, and they're not plugged into any kind of diagnosis. It's more of what happened to you, what brought you here, and how can we help you? So it's very person-centered, very trauma-informed too. We ask our guests constantly, do you feel safe here? And they'll give us some pointers and whatever, and we'll change the environment as much as we have to ensure that people feel safe when they come to us. Because when people are in that state of mind, when you're in crisis, you're not thinking, real clear about everything. And the more you can make a safe environment, a welcoming environment, the better information you're going to get from that individual, and the better outcome you're going to have as they go into the services.
Yeah, I imagine the experience is really what makes it.
It really is, and we get testimonies constantly. We don't even ask for them. People will say, nobody's ever treated me this way before. Nobody's ever asked me those questions before. I feel so good here. Thank you for everything you do. And we'll get follow-up phone calls, follow-up letters and things from guests that came to say thank you for saving my life, thank you for helping me, thank you for helping my son, daughter. It does make a difference the way you treat people.
Can you speak to the peer-led aspect of the organization?
That's most that's where most of our pride comes from, is that we are a peer-led, peer-run organization, and operating a crisis stabilization center. So it's more of a non-clinical model. It's a very supportive model that we've created, but we do have therapists there. We have social workers and licensed social workers, and we have CASACs there. Recovery specialists are there. Peers are there, of course. Some of those employees under, social work or whatever also disclose that they've also had mental health or substance use issues. So it is primarily a peer-run stabilization center. And it's important to us because the mutuality is what helps build trust in the people you serve. When you can say to someone, I may not know exactly what you're going through, but I can tell you my lived experience is similar, and this is what happened to me. Yeah. And that really creates a better and stronger relationship with the person that you're serving.
Yeah, absolutely. In a previous conversation that we had, you mentioned that the New York State Office of Mental Health has started work on developing a similar model based on your Crisis Stabilization Center, so it can be implemented across the state. What is your role in helping them get this developed?
Yeah, this was a great thing. I had been working exclusively on building a funding tool under Medicaid to make the Stabilization Center more sustainable, and to also say to the county, we can give your money back eventually because we built a sustainable tool that will allow us to pay for it through Medicaid dollars instead of county dollars. When I shared that with the Office of Mental Health, they said, well, we like the Stabilization Center idea, and we're going to license it, and we're going to find a payment system through the licensing. And I was a little upset, and I said, did I do this work for nothing? Because now you're going to give us this license and we go forward with that. But no, they wanted the tool that I created. So I shared that with them. And I also shared a lot of the philosophy and the operations of the Stabilization Center, so they could put that into the licensing to keep it to keep the fidelity true to the values of trauma-informed and peer-centered, also person-centered, and focused on moving someone along the continuum more efficiently and effectively than a hospital emergency room could or other crisis services can.
Mm-hmm. Do you view this being replicated across the country beyond just New York State?
I do, and we're hearing more and more about it, stabilization centers. The only thing I think that's different is, is the leadership or the philosophies behind them run differently. So I've been to some stabilization centers that were very similar to walking into a hospital emergency room, which is not the most welcoming environment. And then I've been to other stabilization centers that are more welcoming, their environments feel safer and look nicer. So it's a mix. What I would like to see is the fidelity of the model that we've created go forward, because I just, how can you say no to a comfortable and engaging and friendly environment rather than that cold-hearted kind of,
Absolutely.
What's wrong with you and why are you here again? We don't do that.
Just something that came to my mind. How has COVID impacted your operations?
Yeah, when it first started, we went into a slight panic mode to say, how are we going to do this? And then we went to telephonic, then we went to web and telephonics, like a telehealth was happening. And as time progressed and people were vaccinated, we started opening up to guests again. At the time, we were only taking guests and personally when they were brought in by the police. What I didn't mention is that we also have trained about 700 police in the county about the Stabilization Center, but also train them in crisis intervention team training, which is a 40-hour training on how to engage more safely the community members that are struggling with addiction or substance use or mental health issues. And so we were taking those folks in during COVID because we had the space to separate and keep everyone safe. And then as COVID, more people got vaccinated, we started opening up in different capacities, 25%, 50%, 75%, which is where we are now.
So going forward, what would you say your vision is for the future of the Crisis Stabilization Center and the treatment model in general?
Well, it's evolving for us. When we first opened it, we had a partner. One of our partners was the hospital. We have several partners in the center. We have a case manager organization that helps out. We have a children and family organization that has staff that work with us in the center. And we had nursing, and we never really got to the level of need for the nursing when we had it. So we eliminated it about 2.5 years ago, because we have partners. We have medical partners in the community. And based on self-assessments, if somebody was challenged with any medical conditions, we could get them right to our partner. So we didn't need that nursing. But now, as we've evolved, I can see the need for a better health assessment, and a nurse would be helpful to have. So that's going to happen. But overall, I think, we're learning every day about what's working, what's not working, and we're very attuned to, the success and the strength of the people we serve. So we're making constant modifications to the environment, constant modifications to our workflow, including more peers in there. We put another social worker in there. So it is growing with capacity. And then the vision I have is that these are in every county going forward, but also that the systems of care, the community responds to these. So what I mean is you can open a stabilization center and say, we have a stabilization center, but if you don't have the partners and the workflow to get people to community services immediately, it's not going to be successful. It's going to become another kind of holding area for people in crisis instead of, a wellness area for moving people along continuum. So there's a lot of asset-based community development work that needs to be done to ensure that every stabilization center is successful in what they do.
That's a big job in each community that you move into.
It really is. Yeah.
Yeah. Well, I wanted to thank you for taking the time. It's been a pleasure to have this conversation. And thank you for being part of the launch of our series. For more information
for
about
having me.
Steve and the Dutchess County Crisis Stabilization Center, please visit People USA at people-usa.org and stay tuned for the next installment of the Behavioral Health News Spotlight on Wellness and Excellence series.
And thank you for having me.
Thanks a lot, Steve.
Take care.